Welcome to the continuation of my Invisalign journey. I believe we're on episode 10 now. And as of today, the Detroit Lions are 1-0-1. That's right, one victory and one tie. So officially undefeated. For now, I hope to see you all in Miami for the Super Bowl. This is our year. Anyways, episode 10, I'm going to be talking about the treatment plan. This is probably the funnest part of orthodontics besides the celebrations and the day-to-day, but the actual, for an orthodontist, the treatment planning, kind of being creative, using your science, art, and creativity to kind of come up with the best plan for yourself. So I'm going to quickly review my initial concerns. If you can come over to the screen, this is me back in December when I first began my Invisalign journey. If you can see down here, I had some misalignment on this lateral incisor. I had this molar that was rotated, but my main concern was really just the wear of my teeth. I had a ton of wear. If you can see on like this cuspid, and I have this fractured tooth, and if you look at my lower incisors, they're all kind of worn down. And that's because I was biting prematurely on my back teeth. You can see, you can't see back there, but I'm hitting very heavy on my second molars and only my second molars. And so what that did is it caused a lot of tension here. And I can say in about the 7 or 8 months that I've been wearing my aligners now, this has tremendously, I haven't had any issues with my temporalis strain. So that was probably my number one chief concern, and that has been accomplished. And we'll just scoot over here. This is me today. You can see what I did is I over-exaggerated the intrusion of those teeth. And so now I have no contacts on this upper right. It's a little bit extreme. I'm gonna correct for that later, okay? On this side, we have just a light contact. If you can look back there, and actually, you can see if you can see this tooth here, there's no contact there, and then we have a light contact on that molar. So that has tremendously relieved the pressure on my temporalis, because what happens is you hit prematurely on that, and you don't want to continue to hit on that, and so you slide your jaw forward to hinge around that contact, and what you end up doing is wearing down these teeth. Can you see all that wear? How I have flattened cusp there, flattened cusp on the bottoms. All my teeth are flattened off. Okay, so mission accomplished there. And then let's go and take a look at the. Let's look at this view. This is the lower arch. You can see we have a little bit of improvement here. I'm still going, haven't fully corrected that misalignment of that tooth there, that lateral incisor, but you can see that molar has improved tremendously. Actually, I don't even remember which molar was that. Let's go back. Is that my, yeah, it's this molar here. You can see it's much more aligned and rotated there. So, and then we had a little bit of misalignment of these upper incisors that have improved. Okay. You can see when I started, there was a little bit of misalignment of those teeth, and you can see those are aligned. That's kind of easy stuff, right? So anyways, that was kind of my initial goal. In reality, I have what we call a class 2 bite. Okay, let's go back here. And class 2 bite is really shown here, and I still have this. This is something that I just wasn't really one of my main goals to correct. I wanted to relieve the posterior contacts. But now that I've kind of gone through almost 8 months of this journey, I'm realizing that this routine of wearing these aligners is not so tough. And it's kind of just, it's mindless at this point. So since I'm here, I'm thinking, okay, why don't we do a little bit more? So I'm sitting here at the Refinement, and I'm thinking, can I correct this class 2? And let's talk about that class 2. Again, this is what we call a class 1 here. This is a class 2. And a class 2 can be dental, meaning the teeth shifted forward on the top or back on the front, or it can be skeletal. And in my case, it's skeletal. So if we look here, this is a ceph that helps us determine the relationship of the upper jaw to the lower jaw here. And I drew a line connecting nasion to what we call A point, or the front of the upper jaw and the lower jaw. And they should all somewhat be on the same line. But you can see my jaw set back a little bit. It's not that it's set back, but it has a downward growth instead of a forward growth. This has something to do with growth and development, something that happens from the age of 0 to 6, really, where 60% of your facial growth is complete. This is why I highly recommend that kids come in to see us no later than the age of 7, so we can try to eliminate habits, try to redirect growth if possible. But anyways, this is my case here. Okay, so this is why I'm class 2, because I have a downward growth and my lower jaw setback relative to my upper jaw. So what do I really need to do? If you look at my facial profile here, you can see my chin's kind of set back I have this big nose that doesn't really help my cause, right? Because I have kind of a flat lip to begin with. So ideally what needs to happen is I need to have my jaw broken and this needs to come forward. Now, I'm not gonna do that. I'm not gonna go through surgery. To me, it's not worth it. We do surgical orthodontic cases all the time here, but for me, I've decided that that's just not something that, it's not that important to me. And since I relieved this pressure here, I don't wanna move forward with any surgery. But there are still some things bothering me, okay? Let's go back to my photos. Again, let's look at this photo here. Great big nose, decent lip posture, but you can see my lower jaw set back, okay? So if we're not gonna move my lower jaw forward a little bit, and I really don't think it needs to be, I think I have a good chin and good lip posture, but if we're not gonna move this jaw forward, then can we move these teeth back? Well, that's what we do a lot of times, right, with a motion appliance. I'm going to talk about a motion appliance. There's several ways to distalize teeth. This is just one of the tools we use. But it's something you always got to think about. When you're doing when you're making a treatment plan, there's always some sort of compromise with one treatment plan versus the other. There's surgery, right? I don't want to go in a hospital and leave all of you folks here because I'll probably have to be out of the office for at least a week or two. So it's not that critical to me. It's not affecting my life that greatly. But it would be nice to kind of distalize a little bit. Distalize meaning push all these top teeth back, right? And now if I was younger and I was still growing, maybe we could talk about redirecting my growth potential, but that's out of the question past the age of really 13, 14 for a male, okay? So what are we gonna do here? So if we talk about distalizing, I'm gonna go back here again. One thing we're gonna do is we're gonna push these top teeth back, okay? Because right now you can see I have this relationship here, right? And if you look here, you see how I have this, what we call an increased overjet? And so we'd be pushing that back. Well, guess what? Guess what supports the lip posture? The angulation and the position of these front teeth. So as we distalize, we're gonna be flattening my lip a little bit, which could prematurely age you, okay? And since I already have a big schnoz to begin with, that might make it look a little bit more funny. But I think we can get away with distalizing it a little bit. I'm not that vain. I think I can handle a little bit of lip flattening. I guess if I could, maybe when I get older, I can grow a mustache. Fingers crossed, we'll see. So what's the other problem with distalization? If we distalize, again, we're gonna flatten that lip a little bit. We're gonna make my nose look even bigger, but let's take a look at this x-ray here. This x-ray, I already have a lot of bone loss over here. This is my upper right. And this tooth is ankylosed. And this was a big project for my orthodontist when I was a kid, my orthodontist being my father, is this tooth would not budge. It would not come down. You can see how that root's up there in the sinus compared to these ones here, okay? And this root used to look like this. It used to have a big old hook on it. And so one idea they had is to section that root and see if they can get that tooth to move. Guess what? The tooth still has not moved, and over the years I've experienced a lot of recession. I think it was a good plan at the time. In hindsight, here I am at 32, and this tooth unfortunately has to be pulled. I'll get to that in just one moment. But if you look back here, this tooth has also experienced a lot of bone loss. So now I'm talking about moving this tooth backwards, and when you move teeth, bone does go with it, okay? But I do want to be cautious because I don't know how much bone's back here. My feeling is I already know I got to lose this tooth because there's a cavity in the roots, okay? But I don't want to lose this tooth. And unfortunately, probably by the time I'm 50, I feel like that's going to be a goner too, but I want to keep that as long as I can. On this side, you can see the bone's a little bit better. So I'm a little more optimistic about moving the teeth this way. Well, here's the good news. I don't think that I'm going to be able to correct my bite all the way. I don't think I'm going to be able to distalize the teeth all the way back to get it to perfect. But one thing I want to improve on is my midline, right? You can see that my midline is off here, all right? And it's off to the side. So what I want to do is shift it to the left. And this is off to my facial midline as well. Let's go look at that in my smiling here, right? Here's my nose. You can see how my midline's off? Everyone always tells me I have beautiful teeth. And thank you, I appreciate that compliment. But as an orthodontist looking at that, that's always bothered me, my midline being shifted a little bit. So if I distalize that side, this side, a little bit, my goal is to at least get my midlines a little bit more aligned, okay? So that's the goal. Now the problem is, now how do we distalize, right? We can distalize a number of ways, and I've been thinking about this in my mind for years, okay? Do we put TADs? What's a TAD? A TAD's a mini implant where we put it maybe in the palate and we use that to help push all the teeth back. That's one option. But another option that I really want to try, because this experience has been so invaluable to me. I had braces as a child. I've done Invisalign, and we do a ton of Invisalign and aligners here at the office, and this has been one of the greatest learning experiences for me to be relatable to my patients. But another thing we do quite a bit here at the office is this motion appliance, and that is an appliance that helps to distalize. So what I've decided to do is to use the motion appliance because I want to experience it for myself. If I'm treating a bunch of people with it, I want to experience it, okay? And one of the downsides is it has an extrusive effect, right? So this is why I over intruded these teeth, because I know when I put elastics on there, it's gonna extrude it a little bit. So I'm trying to compensate for this rubber band that's gonna be extruding that a little bit. And what we're gonna do is try to distalize from here to here, okay? Now, what's the problem with distalization? Whether we use the TADs, whether we use a pendulum, which is a whole nother appliance, or whether we use the motion. The problem is this tooth is ankylosed. Remember, I told you it cannot move. So, it's time. It's time to go. It held on. I think I had that done when I was 12 years old. If you can see, I have a little cavity up in the root there. So as much as I've tried to keep this clean, this is just one of those things where you need to see your periodontist, you need to have a graft done, and I never had that done. And so you can see right there, that's just an area, it's so hard because your roots, they come like this, right? This is my upper roots. And as much as I brush and floss, you just get that little decay in there that you just cannot get to, no matter what. And unfortunately, I got the cavity. So my first cavity of my life, unfortunately, I'll have to finally part ways with that troublesome tooth. It'll probably be a huge relief, okay? So anyways, we have to take this tooth off. So when we normally do the motion appliance, you can see here we put it from the canine to the molar, but that tooth doesn't move, right? So what I decided I'm gonna do is I'm going to get that tooth taken out so that these teeth can move. I'm gonna put this on the first premolar and the second molar back here, okay? And that's gonna help to shift this side. Now this side's not so bad. Let's take a look at the left side. Now the left side, that's a full step. That's gonna be a little more involved. And this is why I say, can I correct this overbite all the way without putting teeth outside the bone in the posterior, without compromising the teeth in the front, okay? So I'm gonna start slow, and my plan is just to kind of move that midline over a little bit better so that I can correct this a little bit better, okay? Am I gonna correct it all the way? We'll see. I'm gonna play appointment by appointment just like I would for any of you, okay? So again, I'm showing you my original photos to compare. These are the updated ones that we sent in for the refinement, and you can see it's the same thing. Although we correct some of those alignments, my midline is still off, right? I wanna correct that, right? We wanna shift that all over. If we look on the left side here, we can see this all has to go over. Not the best photos here, but that's okay. Right, and then this is the, excuse me, let's go back here. And then this is the side with the cavity, that's gonna be taken out. And that side actually looks class 1, right? So that side doesn't have to go back too far. So that's okay, that's good, because that was the side I'm worried about. So that's promising, all right? So let's go to the ClinCheck. This is the treatment plan that I came up with. And you can see my current ClinCheck. And what I've done is I've been wearing this set. I'm on actually, this is my second set. I'm on aligner 8 right now. And I've just been working because we've been busy in the summer. So I just kept working on this rotation, worked out this rotation a little bit more. And it's amazing, actually. Like I said, this is the first time I've been able to bite on these premolars. It feels amazing because I've been hitting so heavy on these back teeth my whole life. So anyways, what I've done is I've been working on that. I'm waiting until we get a slower time and a time when I can get my oral surgeon friend to help me out and take that tooth out, okay? And then you can see I set this up so there's a little cutout here for elastics. And like I mentioned, we intruded that because I know I'm gonna get an extrusive effect, and we're gonna have that motion going from here to here as soon as I get that tooth taken out. And then on this side, you can see I got a little cutout. We're gonna put a little hook, and I'm gonna have the motion running from here to here. Okay, and we're gonna try to distalize that as I'm intruding this to counteract that force. So I'm excited about that plan. I don't know that I'm gonna correct this all the way, but I think it's a good try, right? You can see how I'm intruding that as we go. I'm not correcting that class 2 right now because we're gonna do that with the motion. So I think this is a good plan. Like I said, this has been invaluable. This has been an awesome experience, and I'm happy to share it with all of you. If you have any other questions, please don't hesitate. You can contact us at info@lifetimeortho.com. You can contact me on my cell phone. It's on our website somewhere if you really care to look for it, and you can shoot me a text, or you can come in and just chat. So thank you for following along on my journey. We'll see you for episode 11. I'm going to talk a little bit about how to clean your aligners and the different ways you can clean them. Okay? Cheers.